Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Hook. Picture this. An anxious partner rushes into an emergency room with an older adult who's confused and can't speak for themselves. The triage nurse scans a single, clearly written page handed over by the partner. Current meds with doses and times, a list of allergies, the last INR and kidney function, and a one-line summary of baseline cognition. Within minutes, medications that could have caused harm are withheld, and necessary CT is ordered without delay, and the team avoids repeating tests already done that morning at the clinic. That single page changed the course of care. I've seen that happen more than once, and it's exactly why a personal health binder matters. Section 1. What you'll get and why it matters. By the end of this episode, you will have 3 things you can use immediately. 1. A one-page medical snapshot template you can print or save to a phone. 2. A starter checklist that tells you exactly what to collect. And 3. 2 short, high-impact scripts to hand to clinicians in an emergency or a new visit. Why bother? Because organized information speeds care, reduces errors, and gives you leverage as an advocate. In clinic and in the hospital, I watch avoidable delays happen when medication lists are incomplete, immunizations are unknown, or test results are scattered between systems. A concise, accurate snapshot prevents duplicate tests, prevents harmful medication interactions, and often prevents unnecessary admissions. What to include on that one-page snapshot? The essentials. Start with your name, date of birth, and a single emergency contact with relationship and phone. Then your top lines, current medications with dose, route, and time of day, brand and generic names if space allows, documented allergies with reaction type, for example, penicillin, hives, active diagnoses, and the year diagnosed for context, major surgeries with dates, key immunizations like influenza, Tdap, and COVID series, and the most recent important labs or imaging results and dates. For example, creatinine 1.2 on 2025-0201, INR 2.3 on 2025-0202. Add advanced directives with location and proxy name, and a one-sentence baseline medical summary. For example, lives independently, baseline memory, mild forgetfulness, oxygen not needed. That one sentence helps clinicians orient quickly. Section 2. How to organize and protect it. Choose paper, digital, or both. A physical binder with labeled tabs is low-tech and reliable. A 1-inch 3-ring binder with a clear front pocket for your one-page snapshot and tabs for medications, allergies, diagnostics, legal documents, and contacts works great. For digital, use a secure notes app or an encrypted PDF stored in a password manager or a HIPAA-compliant patient portal export if available. File name conventions matter. Use last name, first name, medbinder v2023-2024.pdf so you can tell the latest version at a glance. Version control is simple. Include a last updated date at the top of the one-page snapshot and save older versions in a folder labeled Archive. If you print for the ER, carry only the one-page snapshot and critical legal papers. Leave full records locked at home or encrypted on a device. Remember privacy. Don't carry unnecessary sensitive details unless they are needed for care. Maintenance plan, keep it simple so you'll actually do it. Initial setup, expect 30 to 60 minutes the first time. Collect medication bottles, open your portal, and copy dates for major surgeries and immunizations. After that, set a recurring calendar reminder. Quick monthly checks of medications and the last updated date take 5 to 10 minutes. Whoever is the primary organizer, patient, partner, or caregiver, should own the monthly check, and every major transition of care triggers an update. Hospital admission, new specialty diagnosis, or a significant med change. Integrate portal downloads by saving visit summaries as PDFs and extracting the one-line facts you need. Don't try to copy entire notes into a binder. How to share and use it. Scripts that work. Hand the one-page snapshot to the triage nurse and say, "Hi, this page lists current meds, allergies, last labs, and who to call. It's updated as of today." If you're at a new clinic, start intake with, "I brought a one-page medical summary to speed things up. May I give it to the nurse or add it to my chart?" Those 2 short lines make clinicians pause to read and often change the flow of the visit for the better. If someone can't speak, a caregiver can say, "Patient nonverbal. This page has meds and allergies and the advanced directive location." Say it calmly and hand the page. Action speaks louder than explanation. Section 3. Common pitfalls and red flags and the 3 takeaways. First pitfall, outdated medication lists. If a med is stopped, cross it out with the stop date. Never leave old meds on the front page. Second pitfall, oversharing sensitive information. You don't need to put mental health or sexual history details on a wallet card for emergency use, unless it directly affects immediate care. Instead, keep those details in a secure section of your binder and share on a need-to-know basis. Third pitfall, relying only on memory. Memory fails under stress. Written facts don't. Now, the 3 quick takeaways I want you to remember. 1. A concise one-page snapshot can save time and reduce harm in emergencies. 2. Update regularly and store backups securely. 3. Learn and use 2 short scripts to hand to clinicians so your information gets read and acted on immediately. Those 3 actions, snapshot, maintenance, and communication, are your fastest path to safer care. Recap and next steps. Here's a quick checklist to get you started right now. Grab a blank sheet and write name and DOB, 1 emergency contact, current meds with doses, allergies with reaction, 1-line medical baseline, last labs or key results, and last updated date. Set a 30-minute block this evening or this weekend to assemble those items. If you want a minimal starter, print or copy the one-page snapshot template from the show notes. Fill in the essentials, then cup it in your wallet or phone. It's low effort and high impact. If you found this episode useful, please subscribe so you don't miss practical tools like this. If you want templates or a printable starter one-pager, check the show notes or visit FAQ by nursejessicaconsulting.com for downloadable resources. Subscribing helps this education reach the people who need it most. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at FAQ by nursejessicaconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.